NABN, New Africa Broadcasting Network.
Hi, this is Dr. Terrence Baker coming to you from the studios of NABNTV to present you with an update on coronavirus in Africa. As coronavirus spreads around the globe, countries in Africa have been taking rigorous preventative measures to keep the disease out. There are now more than 1,000 cases reported in over 11 countries in Africa. Countries that have been vigorous in their closure of their borders, like Kenya and recently Nigeria, are faring better than nations in which the borders have remained open. Certainly isolating yourself from the coronavirus is an important first step in national protection. Egypt remains the nation with the most reported cases, with currently over 366 cases at the time of this recording, with half of all cases, of all the cases reported in the entire continent. 19 deaths have occurred at the time of this recording. Most of the cases in Egypt came from among passengers and crew members aboard a Nile cruise ship that was coming from the southern city of Aswan to Luxor. And so this is an example of the disease being brought into the nation by tourists and travelers. In South Africa, there's about 709 cases of the virus so far. Additional testing with private labs and precautions such as hand washing and social distancing are now in place. In Nigeria, there are currently around 46 cases at the time of this filming. Routine coronavirus measures are in place. Health officials report that they are increasing their testing, social distancing, washing of hands, and closing of their borders. The outbreak has prompted air traffic restrictions and cancellation of high-level conferences throughout the continent of Africa. Certainly, isolation of a nation is an important first step in preventing infected visitors from bringing the disease home. There are many examples where visitors have either brought the disease into the African nations, including healthcare workers who were visiting other nations to be trained, or diplomats going to other nations to work out diplomatic policies and returning only to become infected with the illness. I mean, throughout Europe and throughout the African continent, there are many leaders are becoming infected with the coronavirus, and their staffs also. Reported cases currently show that the nations, Algeria, 264 cases, Burkina Faso, 114 cases, Cameroon, 70 cases, Democratic Republic of Congo, 45 cases, Egypt, 422 cases, Morocco, 179, Nigeria, 46, South Africa, 709, Tanzania, 119, Togo, 1. Safety measures that all Africans can take is very, very important. Wash your hands frequently after being outside of your home. Wash your clothes, especially after being outside of your home and returning from work or errands. Avoid groups of larger than 10 people at a time. Isolate yourself at home and work if you become sick. Isolate yourself from others in the community as much as possible in general. Keep your environment and your workspace clean using soap and water. The coronavirus is easy to destroy and inactivate using soap and water on your hands and to clean the environment around you. Avoid unnecessary travel. Avoid cruise ships and flying except for essential travel and emergent situations. Wash your clothes daily using laundry detergent. Most laundry detergents and soaps inactivate the coronavirus. Air out your clothes by opening windows during the day to provide circulation, and remember that coronavirus is inactivated by sunlight. Expose yourself to sunlight 20 minutes per day, as coronavirus is inhibited by sunlight. Remember that coronavirus can be spread by droplets that occur from breathing in the particles from someone who is sick around you or from someone who's coughing and sneezing. Droplets can attach to dust in the environment and can circulate for 5 hours or more, and they are waiting for you to breathe them in. Remember, the only way the coronavirus can harm you is if it goes from the surface of a counter, or as someone who has it coughs, sneezes, or is breathing in and around you closely, and the virus enters your mouth and your nose or your eyes and then can spread to the lungs where it can infect you. You can only be infected if the tiny virus particle enters your nose, your eyes, or your mouth and is able to make its way to the lungs, where it then begins to attach to lung cells and reproduce. And through the reproduction causes pneumonia, sometimes serious pneumonia, which can result in death. Coronavirus is easy to kill. It is actually a small piece of protein that is surrounded by an envelope of fat. And just you think about washing your dishes that have some fat on the dishes. Just about any kind of soap will remove that fat. Well, that's what you're trying to do with the coronavirus. You're trying to damage the outer fat envelope that it travels in, and by damaging the envelope, you keep it from being able to get into your lungs and cause injury. In summary, coronavirus is a tiny particle of genetic information wrapped in a fat envelope. The coronavirus can only make you sick by getting into your lungs and attaching to your lung cells, where it then drills a hole in the side of the cells and begins to reproduce itself. When it reproduces itself, the cell in your lung is damaged, and out comes hundreds and thousands of small new coronavirus, baby coronavirus, ready to infect the next cell. And how you get a pneumonia is that you have more and more cells of the lungs are damaged and injured, and doctors are at this time do not have a medical protocol, that is a series of medications necessary to reverse that process, although we believe that the cure for coronavirus is close. Universities around the nation, both in China, here in the United States, and in Europe, are working around the clock with protocols that we believe will soon produce the cure. We also believe that a vaccination is only a short time away, and we're waiting for human study trials to be completed. Our job is to keep the particle of genetic information, which has the ability to biohack your lung cells and turn them into coronavirus-producing machines out of your lungs. If you and I can stop the spread of this particle and stop this virus particle from infecting our lungs for the next 2 to 4 weeks, this invasion, this pandemic of infection will stop. The assignment of everyone hearing this message is to prevent the coronavirus from spreading into the lungs of yourself, your family, and those around you. If you follow the measures as listed above, your chances of avoiding the coronavirus or limiting its spread is very high. The survival of humanity against this tiny viral invader can be successful if you and I participate in isolating the viral invader and allowing it to be either destroyed through our cleaning efforts or by its failure to find the necessary lung cells to reproduce. Frequently asked questions: how do I protect myself and my family against the new coronavirus? You need to follow coronavirus protocols that we just reviewed with you. You need to recognize the symptoms of COVID-19. Is it possible to distinguish a cold or flu from COVID-19? And for you and I, it is not. If you're feeling sick, isolate yourself. If your sickness continues, including fever, cough, shortness of breath, seek medical attention from your primary care physician and your family doctor. Stay up to date on breaking developments. I also recommend you follow all advice of state, federal, government officials who are committed to your safety. Thank you. I appreciate this time to be with you to review an update on coronavirus in Africa. I'd also encourage you to watch out for NABNTV Health Talk Show, Doctors in the House. A new program is all about healthcare and wellness. It is a program designed to bring different specialist doctors to this studio, NABNTV, to discuss various medical issues in our community. The program is very informative and educational, and you will learn more about this program and more about multiple medical conditions that are common throughout the world. Please join us by subscribing to NABNTV. You can also follow us on Facebook, Instagram, and Twitter. You will also learn more about other programs that we broadcast. Please subscribe to NABNTV today. We look forward to you joining our family of subscribers. Thank you. This is Terrence L. Baker, MD, coming to you from the studios of NABNTV.
NABNTV.